Hi everyone, welcome to today's Nutrition and Medical Sciences taste session. Thank you so much for joining us. My name is Anissa and I'm currently an MSc Dietetics student here at UCL. I'm also your chair for this afternoon. So in this session, we're hoping we'll address course-specific questions you may have, and it will also help to give you an insight into what it's really like to study on the Nutrition and Medical Sciences undergraduate program. So this afternoon, we have our speaker, Dr. Adrian Slee, and he will introduce you to some of the great science and medicine that you would learn as a student on this course. And he will also provide a summary of the Nutrition and Medical Sciences program, and there will also be a Q&A session for the second part of the event. So this session today is being recorded and it will be made available later on our website following the event. We're also here to respond to any questions you have, so please do use the Q&A function on Zoom to send these throughout the event. I will now introduce our speaker. So we have Dr. Adrian Slee. He is a registered nutritionist and course director for the BSc Nutrition and Medical Sciences course at UCL. He teaches, Dr. Slee coordinates several modules on both the undergraduate and MSc programs and teaches topics including nutrition throughout the life cycle, body composition. He also conducts research examining the importance of malnutrition in aging and how this relates to frailty. Over to you, Adrian. Thank you.
Thank you very much, Anissa. So, hi everyone. Very nice to meet you all. So, meeting you obviously virtually, and hopefully see you in real life in some months' time. So, to give you a bit of background, I've been at UCL for actually 6 years now. So, I'm the course director for the BSc Nutrition and Medical Sciences course. Originally, a long time ago, I did a degree in physiology and biochemistry with nutrition. Because I was interested in metabolism and nutrition, specifically what happens, for example, with exercise, for example, and what happens during disease states. So how does our body change and how do we metabolize things differently in different circumstances? And so I had a real interest and a real passion for this. And I was specifically interested in things like how muscle works. And I did a PhD on specifically skeletal muscle proteolysis, which is essentially protein breakdown. So I was interested in how skeletal muscle changes with disease, for example, and again with different stimuli, such as things like exercise. And then I got into teaching. So I've worked at a number of different institutions as a lecturer, and as a course leader for different degrees and different sport, health and exercise science degrees, different nutrition degrees. Then I came to UCL. I would say, first of all, it's a really fantastic institution. And I'm going to tell you all about our wonderful course, which is very novel. I think it's probably the only course like it in the UK. I'm not sure around the world, but definitely within the UK, it's a very unique course. And I'm going to tell you a little bit about the course at the end of this presentation and why it's different to other courses that you might have already been to some different open days in person and online. And I'm going to tell you about it and how it relates to our other programs, because we have some other wonderful MSc programs on our course. For example, Anissa is on our MSc in Dietetics. So you see how these things interrelate. And Anissa was actually a graduate from our BSc program. She'll talk to you about that later as well. And the other thing to note as well is that I'm very interested in research. So I have interests related to malnutrition in aging, for example, and the loss of muscle mass and function, something called sarcopenia, you might have heard of before, and frailty, and how that relates to things like quality of life in different patients, for example. And one thing to note is that with all our courses at UCL, this is one of UCL's biggest strengths actually, is that we're very research driven. We have research led teaching. So when you get taught things, you're taught by professors who are absolute experts in the field. And so it goes hand in hand, so this is one of the key strengths. But first of all, I'm going to give you a little bit of a background, just for a bit of fun. Okay, it's just a little bit of content that's very relevant, some very relevant topics, such as energy balance that you might have heard of before, and something called nutritional assessment. So we're going to talk about this. And this is essentially the bread and butter of understanding nutrition and what a nutritionist might do. So a nutritionist might do a nutritional assessment of someone, and we're going to talk about what that means. And also, if you become a dietitian working in a clinical environment, in a hospital, again, this is something you would do on a daily basis, where you might assess a patient in that type of setting, or in the community, for example. And so in this degree, you learn the basics, these core aspects of what nutrition is all about. And as I say, these topics are highly relevant to our current world, especially in the advent of things like, for example, high levels of obesity, but also chronic diseases. By the way, pardon me, I'm just recovering from COVID, so if my throat knocks out and I have to keep having a swig of drink, you'll know why. So I'm going to give you a bit of background, and please feel free, if I ask you a few questions, use the chat, okay? I would really appreciate some interaction. It makes it far more fun and more interesting. And here we go. So what do we mean by the term energy balance? Can anyone tell us? So you probably heard this term, you know, for example, in the news, people talk about energy balance, people talk about obesity a lot, for example. What do you mean by the term energy balance? Is there anything in the chat? So I can't see all the chat at the minute because well, perhaps I can. What do we think? So what happens if your body's in positive energy balance? Anyone have any ideas at all? So there's a hand up there. I don't know if you probably can't use microphones, unfortunately. Any ideas? Okay, so we're interested in energy balance because it's basically the relationship between the energy that goes into the body, okay, from the diet, and the energy we expend. And that can be part of just the daily calories that keep you alive. We call that our basal metabolic rate, but also as a component of physical activity. So why is this most important? So at the moment, we know, for example, in the Western world, we have a bit of a problem with the rise in obesity and type 2 diabetes. And we know that what happens, for example, when someone's in positive energy balance for a long period of time, so what that means is, it means that if the energy that you consume is greater than the energy you're expending, okay, so you can see, for example, here, seeing the balance here. So if the energy in is greater, so let's say, for example, you consume 2,750 calories per day, but the energy out that you're expending is much less, then what happens is you're going to store the energy. Okay, there are other things that happen. Your body compensates. Your body will try its best to not put on too much weight, for example. So your body has compensatory mechanisms that we talk about in our course, understanding metabolism, for example, because it's very complicated and intricate. But typically, you're going to lay down some energy as tissue. Okay, so what would you lay down as, and so how do you, what happens with this energy then? Put something in the chat. Is anyone there?
So I don't think the chat function is available, but
Oh, that's a shame.
you can put your answers in the Q&A session, Q&A function, and then I'll just read them out.
That'd be great, Lisa. Thank you very much. So what do we do with this energy? So imagine you've got excess energy. What happens to it?
So someone has written that the energy is stored as fat.
Very good. Where is this fat? Is that fat stored? Because there's different depots. Has anyone heard of visceral fat, for example, or subcutaneous? Have you heard of those terms
Anita
before?
has written that is stored in your muscles.
That's really good. Nice one as well. You're absolutely right. So we store fat in different ways, okay? We can store fat under the skin, so we call that a subcutaneous fat. We can store it viscerally. So for example, in the picture here, if you store fat around your organs, okay, which is underneath the abdominal muscular wall, so surrounding all your organs. That's a really bad thing. Okay, that's been correlated and associated with lots of metabolic disease and cardiovascular disease, for example. So you can store it there, and you can store it in muscle, actually. And that could be used as an energy source if, for example, you exercise. But if you don't exercise and that accumulates, that is actually causes problems. It causes metabolic problems, actually. Do you think that you only store energy just as fat tissue? This comes into later on. We do nutritional assessment. We look at body composition, what your body's made up of. So you don't actually, we actually increase the amount of what we call fat-free mass tissue as well. It's never just fat mass, but we need to understand this because it's complicated. Obesity is a very complicated problem. So we want to assess someone. We need to assess these things. We want to say, okay, maybe we need to assess the energy out, the expenditure. We need to assess the energy coming in, and we might need to assess what's happening to the person physically. Okay, so for example, are they putting on fat mass and where, or are they putting on other tissues like fat-free mass tissues?
Alicia has
Yep,
asked if the energy is stored as glycogen.
that's another really good one as well. If you have excess energy, right, the excess carbohydrate will be stored as glycogen, absolutely, in muscle and liver. It gets more complicated, to be honest. So in diabetes, that's actually much more complicated. But normally, if you have an acute setting with an increase in energy, you will increase glycogen as well. And it's your body's way of trying to compensate rather than just laying down fat tissue. So that's a really interesting one.
Someone else has asked if the energy is stored in ATP.
So it's not, so this is what we cover in the course, right? So ATP, right? We have what we call we have a pool of ATP in the cell. So ATP is like the energy currency of the cell. So it's not that you're going to increase loads and loads of ATP, okay? And there are reasons for that. But what happens is the way you get the energy from is an ATP, it's adenosine triphosphate. Okay, when you break a phosphate bond, say for muscle contraction, you have you might have done this in your A-level biology, for example, is you have the myosin ATPase enzyme, and it breaks down ATP, and you release some energy to do work, like muscle contraction, okay? But you're not going to increase loads and loads of ATP. There's a fixed amount pool, okay? However, you will increase, for example, the amount of glycogen and the amount of lipid within, for example, muscle that can be broken down to make ATP, okay? And we talk about this in the course. We go into metabolism in depth. So thank you for that. So we're interested in these things because this is a major public health problem. Okay, and we have specific, for example, we have modules where we teach this, both at a metabolic perspective and from a public health perspective, but also interested in the other direction, is what happens if you start to lose weight. So we have things such as disease-related malnutrition and wasting, where your body starts to waste away. And that's common in certain disease conditions, with things like cancer and chronic kidney disease, for example. And so at the other end of the spectrum, okay, where someone's in negative energy balance, and it could be, for example, they have a low energy intake. And then what happens is, and again, this is something we cover in depth within our modules, because understand this is absolutely critical, especially if you want to go off to do dietetics to work with patients, is, for example, when you have an illness, your body goes into what's known as like an inflammatory response, and you have these things called cytokine molecules that you might have covered in your biology. And these molecules go to the brain, the hypothalamus, that regulates appetite, and they reduce appetite. So you don't want to consume so much food anymore. However, even if you're completely physically inactive, you might be lying in a hospital bed. Sometimes your body can be working harder. We call this hypermetabolism because of this inflammatory stress. So if someone has a chronic disease that is quite severe in nature, like, for example, could be end-stage kidney disease, for example, we know that it's quite common that your body, even at rest, that tissue is using more energy. There's more cycling taking place. And again, this is something we need to understand from a metabolic perspective. What's happening? Now, overall, as a person, this is problematic because you lose weight. Okay, you lose healthy muscle tissue. And that means you lose function, because once you've lost some of that muscle made of protein, the ability to do like basic tasks, activity, we call them activities of daily living. So for example, it might be just going around the house, cooking, cleaning, going to the shops, just getting food, for example, becomes more difficult. Or you might have difficulty walking up the stairs, for example. And it can affect, we have there's a term called frailty that we use when someone becomes frail. And this affects quality of life, and overall it affects morbidity and mortality. So we're interested at both ends of the spectrum. So this angle and this angle from both a metabolic perspective, but also how it affects people. So quality of life, public health perspectives as well. And these are the things that we cover in the course. How can we assess these things? How can we assess energy balance? We're trying to explain why this is so important, especially in our current era. In the current day, we have high rates of obesity, we have high rates of chronic disease as well. So how can we assess these things? If you just put it in the Q&A, any ideas? Anyone got any ideas at all? What could we look at to have some idea of what's happening?
Someone has written BMI, check your BMI.
Good start. So that's the body mass index. It's a good start. Very good. Anything else? Any ideas at all? So looking at the balance here, this equation, energy in, energy out. Is there anything we can measure here, or is there anything we can measure there?
Someone else has written you could check the calories or ask about eating habits and track calorie consumption.
Good stuff. That's very good. So looking at energy intake, there's different ways of doing that. That's very good. So we've had body mass index, and someone's talked about diet. Anything else?
Someone else has also talked about diet, maybe like assessing the abundance of carbs, fat, and protein intake.
So, okay, so what we call macronutrient breakdown. So you look at overall calories and then macronutrients. You could do that. What about this aspect, the energy out? What could we do? Any ideas? Anyone got any ideas? So if we want to do a full assessment of this person, we need to think about a few things, don't we? So you're right. So first of all, we could look at intake. So we could estimate how much energy and how many macronutrients, so carbohydrates, proteins, and fats, for example, someone consumes. We could look at their micronutrients as well. Okay, because sometimes someone might have a very good calorie intake, but they have poor levels of micronutrients. Okay, and so this could obviously lead to other deficiencies and other problems, which again is actually quite common in our current world, perhaps because we're consuming ultra-processed foods, for example, that are high in calories and devoid of micronutrients. We can also look at, so that's from the intake side, there are different ways of doing this. And again, we have whole lectures and we teach this on different modules, and we take you through practicals of how to assess someone's diet. But we can also look at energy expenditure, so how many calories are burned each day. We can do that as well. We can also look at body size, so body mass index is one example of looking at body size. But there's other ways of doing this as well. We can look specifically and be a bit more accurate and look at body composition. So, for example, how much of that energy is stored within, say, muscle, and how much is stored within fat tissue. So we can break that down because obviously that confers with health. And so we do this in class. We do this both theoretically and practically. Okay, so and in particular here for these three things, we actually have specific practicals on these aspects. So for dietary analysis, for example, okay, so I always put this up each year, because usually each year I give a lecture, and it's usually getting close to Halloween. So for a bit of fun, and put up a pumpkin for a laugh. But we use different dietary analysis programs. I mean, this is literally just an example of what a dietary analysis program looks like. We actually use one called Nutritics. So we have licenses for at UCL to use, and all our students get licenses both at BSc and MSc level. And we train you to be able to use this. It's an online system where you can try to estimate someone's calorie, macro, and micronutrient intake. So using, for example, a diet recall approach or a diet diary, it's then possible. Yeah. So once you've worked at, the amounts, the different types of foods and the quantities that someone's consuming on a regular basis, you can then put this into the system and then work out how many calories someone is consuming, and then those individual nutrients, vitamins, minerals, and macronutrients break down. It's also quite interesting as well, just to say, is it gives you lots more information. So not only do you get a breakdown of vitamins and minerals, you get a breakdown of different types of fatty acids, because you may already know this, that things like fish oils, omega-3 fatty acids are meant to be good for you. And there's some good literature behind that to say they are good for you. They confer to health. And so you can look at that. You can actually analyze things like that, or the relationship of monounsaturated fats that you get from olive oil type foods. And so you might have seen this before. So this is the food energy values. So again, you might already be aware of this. So apologies if you already know this. But for carbohydrate and protein, it's about 4 kilocalories per gram. Fat's very dense, so it's a very, 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 very dense nutrient. And you have 9 kilocalories per gram, and alcohol 7 kilocalories per gram. So we can assess all of this using a combination of different approaches, such as a diet recall. So that basically looks back in time, say the last 24 hours, what you consumed, or a prospective diet diary. So you might do a diet diary over 3 or 5 days, for example, over different periods of time, which could be, for example, different periods throughout a year, because your diet might change seasonally. And there are pros and cons with different methods, and that's something we discuss as well. For estimating expenditure, okay, so we first of all, we go into quite some depth, but understanding metabolism, so what happens. So I think some of you, one of you mentioned before about ATP, for example. So we talk about ATP homeostasis. Why is ATP important? How do you make ATP? From breaking down carbohydrates, proteins, and fats. So it's predominantly carbohydrates and fats, but you burn a little bit of protein down as well, depending on the situation. And we can actually measure overall your energy expenditure. We do this actually in-class practical. I did it this morning for our BSc students, and I'm doing it on Friday for our MSc students all day long. We can actually measure how many calories you're basically burning over a period of time. And you can then look at a 24-hour period of time, but we can look at snapshots. That's what we do this morning. We looked at rest, and we did exercise as well, at light and moderate exercise and exercise back. So I'll say this relates back to understanding how we metabolize food, essentially nutrients. And again, some of this you've probably already done in A-level biology, but it's about understanding, for example, you can oxidize glucose and you can oxidize fatty acids. There's something called beta oxidation that you may or may not have heard of before. And you've probably heard of the TCA cycle, the citric acid cycle here, or Krebs cycle. And we can measure different things, okay? Now, it's quite complicated to measure metabolites in muscle, for example. You'd have to take muscle biopsy, or you look for metabolites in the blood. It gets quite complicated, right? But what we can look at overall metabolism, because if, for example, we need oxygen, you might have seen before. So this is the electron transport chain and oxidative phosphorylation, which occurs in the mitochondria. And you make ATP or ATP synthase, but you need oxygen. So just basic cellular respiration, we use oxygen, okay, inspired oxygen, and we produce CO2. You can see I've just got a little star here, red star, CO2. So we can measure these things just by simple gas analysis. We can also look at, so it's not just the amount overall, we can also look at the ratio, something called the respiratory quotient, which is quite interesting. which is the ratio between the CO2 and O2. And that's interesting because it can tell us what you're actually burning. Are you burning more fat or more carbohydrate, which could tell us a lot about your metabolic health, actually. So, for example, glucose, which is C6H12O6, when it's oxidized, it uses 6 moles of oxygen to make 6 moles of carbon dioxide. So that ratio of carbon dioxide to oxygen is a ratio of 1. If we're burning more fat as fuel, and typically what happens, if you're healthy in normal circumstances, and we talk about this in the modules, is throughout a daily period, when you're fasting during the night, your body starts to switch to burning fat as fuel. Okay, it's an important adaptation which occurs. Or if, for example, you go on a low carbohydrate diet, or also with prolonged exercise as well, the body tries to shift to burning fat as fuel, and low intensity exercise, that is. But if, for example, another example, let's imagine you do high intensity exercise. So you go from, say, walking to jogging to running to sprinting. So what happens is you start to become more anaerobic. You start to do more glycolytic metabolism. You use a lot more glucose than fat. And we could see the change in ratio between O2 and CO2. And we can actually assess whether you're burning more glucose or fat as fuel. This shows the energy released from oxidation of these different fuels. So starch, glucose, fat, protein, and alcohol. So you can see the energy released in kilojoules per litre is actually quite similar. You see that there? The energy released per gram, kilojoules per gram, don't forget the Atwater factor. So for example, with fat, this is 39 kilojoules. It's actually 9 kilocalories per gram. So you might remember alcohol is 7. So using this Atwater factor of converting kilojoules to kilocalories, which is 4.1868. And if you remember for starch, for carbohydrates and protein, it's around about 4. It's not exact because you can see it varies slightly. You can also look at this ratio of O2 and CO2 that I've showed you in the previous screen, which was here. You see there's a difference here. So using carbohydrate, you can see there's another release of CO2 here when you go from pyruvate to acetyl-CoA via the enzyme pyruvate dehydrogenase to get into the citric acid cycle. Whereas when you're oxidizing fats, you're going sideways and you produce these CO2, but not this CO2. So there's a different ratio here. That's why that's different. So we can measure this, and we can use this respiratory quotient, which is the ratio between CO2 and O2, to indicate whether someone's burning glucose or fat as fuel. So by measuring things like gas exchange, this is exactly what we did this morning. We had our students on exercise bikes using this, it's called a Douglas bag method, where essentially we have students breathing into this bag. We collect the air in the bag. We do some gas analysis to measure the percentage of oxygen and carbon dioxide, and we measure the volume of gas within that bag. So from that, we can estimate using an equation, it's something called the Weir equation, developed by a professor back in 1949 at the University of Glasgow. So we can work out how many calories you're burning, kilocalories per minute, using just this bit of kit. It can be done. This is the way that we do it in the lab. It's not a gold standard technique, and it's good fun, but there's a lot of errors. This here is an example of some really fancy kit that you now have on the market. It costs around £30,000 to £40,000. We have a couple of these in UCL actually. It's where essentially you could wear this kit. It does what we call breath by breath analysis. And you can see here, there's a little antenna on the back. This actually be communicating with the system back in, say, the lab or whatever. And you can actually measure near gold standard, actually, very precise measurements of O2 and CO2, and then things like oxygen energy expenditure. But you can also do things like maximum oxygen tests with this VO2 max. So if any of you interested in exercise sciences, you might have heard of a VO2 max test before. That's where you're trying to get into the maximum amount of oxygen you can take in with exercise. That's dependent upon things like cardiorespiratory function, blood flow, and then how well your muscle works, how well your muscle metabolizes. This is typically what you have in hospital environments. They're not used, shall we say, as part of standard practice. It's much more common, for example, in intensive care settings, but essentially you have like a ventilation hood. And again, using some really fantastic kit. I mean, we're actually going to use a similar device to one of these for one of our studies that we've got. My PhD student who's studying some CAR-T cancer cell patients, and we're trying to do an in-depth nutritional assessment of this interesting patient group. We'll be doing something like this, a cross between this and this, to assess their energy expenditure, because no one's done this before in the world, actually. So you can use this bit of kit to work out how many calories people expended, because what happens is, which is very interesting, is that you might be lying in a hospital bed, no physical activity at all, and you might think, hold on, my body is, isn't shutting down and it's not consuming many calories. That's not always the case. So if you have a lot of what we call inflammatory stress and metabolic stress, it can raise your metabolism. So we call it hypermetabolism. So even at complete physical rest, you have a higher level of metabolic demands. So you can measure these things. Why is it important? Okay, so it's about understanding. First thing is assessing dietary energy needs, because if you know how many calories someone's expending, then you can say, right, okay, if I know this accurately, I can then put together a plan for whatever it is. If you're trying to put a plan together for someone to losing weight, or to put on weight, or optimizing their performance with sports nutrition. I mention this because we talk about sports nutrition. We have a specific sports nutrition module that I lead, actually. And so a lot of these techniques and different things that we're talking about here have applications not just to clinical settings, such as obesity or ICU or cancer, but also to sports performance, by understanding how to do these different techniques to accurately assess someone. And in the case of an athlete, for example, that might be essential to optimize performance. But if they're, for example, a long distance, could be a long distance runner, an ultra marathon athlete, a Tour de France athlete, for example. So someone who's doing a lot of activity at high intensities for long periods of time, long durations, they're at very high chances of becoming malnourished. And again, this is something that we actually research on at UCL, and I've had undergraduate and postgraduate students actually researching this, which is very interesting. And it's a novel area of research. And so, but you need to accurately assess someone's energy intake, their energy demands, to have a very clear picture of what's happening. Okay, if that makes sense. But in the clinical setting as well, for example, you might want to avoid under or overfeeding the patient, because in some cases that could be life-threatening. And so we cover that within our modules. So, for example, in the final year BSc modules, we have a module devoted to sports nutrition. We have a module devoted to clinical nutrition, so that's the applied nutrition module. And that in particular is very important, because it sets the scene, especially if you want to go off for a dietetics career. So if you want to become a clinical dietitian and work in a hospital, so after the course, you will then need to do have some additional experience and additional postgraduate experience, and do a course specifically on dietetics. So this in particular sets you up for that. And you'll find that many of our students actually go on to work and do dietetics. So what about measuring body size and composition? So what do we think? So just opening it up again to you guys in the Q&A. So you mentioned body mass index, BMI. Is there anything else? Could we look at anything else? Has anyone had their body fat tested before? So at a gym, or I know even in Boots that have these different devices that you can measure your body fat, for example. Any ideas at all? Have we got anything in the Q&A, Anissa?
Not really related to this question. It was more the previous question, but I think you answered it during your talk.
Okay. It can always
Oh
open
wait,
up. Come.
there's so someone said that there is a body tracker at their gym, and it does
Yeah.
tell them their muscle mass and body fat.
Okay,
Uh,
this body tracker, have you got any idea how it works?
I'm not sure if it's the same person that said that previous comment, but someone else said measuring the weight and hydrostatic weighing, possibly. Hydrostatic weighing.
Interesting hydrostatic weighing. So, so we don't do that UCL. You need specialist equipment for that. But that is actually a very good technique. It's an old-fashioned technique of measuring body composition. This body tracker you're talking about sounds to me like a bioelectrical impedance device. And we do all of this within our course. So we have a specific module called Growth and Development in the second year, where we basically show you all how to measure body size and body composition. Again, this is the bread and butter of being a nutritionist. If you want to be a nutritionist, you need to be able to understand how to assess intake. You have to understand expenditure and how you might measure that. And there are different techniques, and I've just mentioned one now. And you need to be able to work out, how do you assess someone's body size and composition? So we do all of this. Okay, the one that you've all probably heard of is the BMI, so the body mass index, which is very simplified, is literally your weight divided by height squared. So it's just the relationship with weight. Now, that doesn't tell us anything about what your body's made up of, so the composition of the body. And what I said at the beginning, someone, for example, might be in the beast range over here, but we don't know what their body's made up of. It could be a combination of it maybe if they've been in positive energy balance for some time, and then also so it's not just fat tissue, it could be muscle tissue as well. So you need to accurately assess that. And is that fat tissue they do have, is it under the skin, so subcutaneous, or is it around the organs, which is more detrimental to health? So we know, as I mentioned at the beginning, that if you store a lot of fat around the middle, so this is called central obesity, it's correlated with things like diabetes, cardiovascular disease. Pardon me. So I'm not a fan of the BMI, by the way. That's the reason why. And we teach you in the course how to accurately measure people. And just to illustrate the point here, this is a very good example. So you might have 5 individuals, okay? They've all got exactly the same body weight, so 70 kilograms. But you can see they've got different height. Okay, so one's tall, one's short. One person might be muscular, the other person's inactive. This is WC, so waist circumference. So you can see that these different people have what we call very different phenotypes. Okay, it's this person here, you can see that over here in inactive has a waist circumference of 97. So you can see that they would start to become at risk, they're getting close to the cutoff point of where it becomes at more at risk of things like cardiovascular and type 2 diabetes. The other interesting thing as well, this is SM, skeletal muscle. So if we could accurately measure them, and I'm taking this from a paper, a research paper, where they did do this. It's just a model, just an example. As you can see, these individuals can have very different muscle masses. So weight by itself doesn't tell us anything. Okay, and this is the most important point. We have to look at other things as well. So by having weight and height, we've got BMI. By having waist circumference, we have an indication of how much tissue is stored around the waist. And as I said, that's really important for health. And if we can measure muscle as well, that's also going to be super helpful. And this is the BMI of these different individuals. And so what's really interesting, I think, as well, if you look at this carefully, you can see that the short individuals at a BMI of 30 here, these two here, the muscular and the inactive, both have a BMI of 24.2. Now that 24.2 is actually completely normal, all right? And so, and actually what's interesting, we talk about this in some of our third year modules, where especially in different disease states, it's really apparent of things such as what we call the body mass index paradox, obesity paradox, where you might have, for example, patients, I can think of many examples in heart failure, also in chronic kidney disease, where someone might have a very high body mass index, maybe even in the 30s and beyond, but actually in those disease conditions, because other things are happening and they're losing muscle and might be putting on fat and there might be some increase in water weight as well and other factors, people have shown it's actually more beneficial for survival to be in an overweight or obese BMI. And so this is the reason I mention this, It's because you have to take these things with a pinch of salt, and you have to look carefully, you have to carefully, accurately assess someone. And to do that, you need to have more information, okay? You need to have more information, and to do that, we need to look at your body composition. So this is how the body's broken up. So we have, for example, your overall. So when we look at body weight, this is everything. When we look at fat-free mass, you heard me mention that at the beginning of the lecture, that's everything that isn't body fat. So typically in obesity, when someone puts on weight, it's not just body fat, actually. Is you put on a bit of muscle, your organs might be bigger, for example, or the bone tissue might be bigger, especially if you have to accommodate, okay, a larger amount of weight, then because of that extra mechanical stress, is your body will actually increase its muscle and bone tissue, actually. So we need to measure these things and and try to do it accurately, or accurately as possible. And there's different ways of doing this. There are different scanning techniques that we can use. There's something called bioelectrical impedance that I mentioned a little bit earlier, and there's some imaging techniques that we can do as well. Typically, though, these tend to be quite expensive, can be very expensive in some circumstances, and sometimes you might have radiation exposure. So trying to find techniques that are cheaper, portable, simple and easy to use is very important. And again, we teach students how to do that on the course. So one thing we actually do, we do anthropometric assessment. And so when we talk about anthropometry, we're talking about measurements of the body, which could include, height and weight, but we can also measure things such as we mentioned waist circumference. We can look at calf circumference using a tape measure. That's a good indication of how much muscle mass you have. We also use these things here. So I don't know if you can see in the right-hand corner, just try and move it out of the way. These are what we call skin fold calipers. So we get students to play around with these, get some experience where we can measure your subcutaneous fat. So for example, this person here, this is the tricep, the back of the arm, but there are lots of different techniques where we measure different sites of the body. So as a practical we do in the second year, where we compare different techniques, such as bioelectrical impedance and skin fold thickness. And so we take measurements at the tricep, in the back, so subscapular, just under the scapular blade, the shoulder blade, also in the bicep region and suprailiac, just above the hip. And then we using an equation, we work out how much body fat you have, and we can compare that to bioelectrical impedance. And this is BAA. So the idea, this is probably what that body tracker was that whoever said in the Q&A chat. So typically what happens is you put a very small harmless current for the body, and what tries to do, this system tries to work out the resistance to current, something called impedance. And using specific equations, we can try to estimate body compartment size. So what it tries to do is it tries to estimate, for example, you can see on the screen here, how much, for example, fat-free mass you have. So if you imagine logically, if any of you have done physics before, is that current, electrical current will flow through hydrated tissues. And the reason for that is because they're hydrated tissues is they have obviously electrolytes. So it could be sodium and potassium, for example, as key examples there. So because the electrolytes, it allows current flow. And if you have, based on the assumption that you got so much fluid, okay, inside the cells, and there's so much fluid outside the cells, so it's intracellular and extracellular, we can estimate, for example, your fat-free mass. And if you remember correctly as well, the body fat, so you probably know this, the body fat tissue is like an insulator. Okay, it insulates the current. It's not well hydrated. So because of these characteristics of the tissue, you can have a fairly good assessment of body composition. So we teach you this, and we teach you how to do it practically. And again, this is something as a nutritionist you could do in your own practice. There are different scanning and imaging techniques. So you might have seen images like this before. This is a DEXA scan. So typically, especially in the NHS in the UK, DEXA scans are given to people at risk of osteoporosis, at risk of fracture. to check your bone tissue density. So you can see here, this is a DEXA scan, it's a whole body DEXA scan. In blue, this is the bone tissue. In red is all your fat-free mass, so all your organs and your skeletal muscle. And then see in yellow here, this is the fat tissue. So this is a really good way, this is what we call a reference standard technique for measuring body compositions. It's a very good way of doing this, very accurate. We can also do things like magnetic resonance imaging, computed tomography. This is this is a sort of scan you'd have at a cross section. So there are different ways you can do this. Okay. However, I mean, MRI and CT is extremely expensive. With CT, you have radiation exposure as well. So this is not done typically as part of routine standard of care for most patients. You could get a DEXA scan done privately. I've had it done privately. I paid, what was it, I think £150 at a clinic somewhere to get it done. It's fascinating. It's quite good fun. It's quite interesting to see what your body's made up of. It actually was very similar to the bioelectrical impedance measurements that I had done the week before. So, and again, we teach you all of this. We talk about how these systems work. We talk about applications. We talk about pros and cons. And again, practically what you might do later on in a clinical setting. So that's an overview. I'm not sure if I haven't gone too far over time. I'll make it 5:20 already. I'm going to very quickly do a course overview. So I realise I'm talking quite a lot, so I apologise for that. So we have this fantastic course. It's unique. Okay, I mentioned at the beginning. It's also accredited with the Association for Nutrition. I don't know of any course like this across the UK. Because we have this nutrition, we have the medical sciences component. So we're very much close and aligned with the applied medical sciences degree that you might have heard of before. You might have seen the prospectus already if you're looking at UCL. And then so what happens in the applied medical sciences degree and the other integrated medical science degrees, we explore in-depth physiology and pathophysiology in our first year of study. Okay, so the idea is that all these core courses study very similar things, but then for nutrition we go off and learn lots of stuff on metabolism, on nutrition, and we have some very cutting-edge modules. For example, these are some examples of some titles we have: nutrition and metabolism, obesity and malnutrition, growth and development. And in the final year, we have very specialized modules such as sports nutrition. We have the applied nutrition, clinical nutrition module. We do public health nutrition, behavioral nutrition, because we want to understand not just metabolic effects, we want to understand the effects of psychology, and how sociological effects, how they impact upon nutrition and vice versa. I actually run a module on frailty and aging, for example, because this is obviously one of my interests. And so, for example, understanding how all these different things we talked about today might have implications on as what happens as we age. And as probably you're aware as well, not only do we have an issue in terms of obesity and chronic diseases, but we also have an issue in that we have and we will have this perspective to be a lot more older people over the age of 60, 65, and also with what we call multi-morbidity. And how do we deal with that? And nutrition is one key component. We also have many novel modules, so optional modules. So we have a couple of nutrition and cancer modules, actually, at second and third year. We have modules on there's one called Where Mind Meets Brain, run by Professor Paul Robinson, who's also the course lead for the Eating Disorders and Clinical Nutrition Master's degree. We have a Microbiome in Health and Disease module, run by Professor Dave Spratt, who's the course leader of Applied Medical Sciences. And all these things are very, very interesting and very applicable. This is the course structure in year 2. So you can see here, these are all the modules that I've talked about here. So we have modules in term 1 and term 2. The malnourishment obesity module runs across both modules. We also still do a little bit more applied medical sciences type stuff. So we have a molecular-based disease module. And then we have some optional modules, such as a nutrition and cancer risk module, which goes into nutritional epidemiology. So, for example, what are the effects of maybe red meat and alcohol or vegetable intake on cancer risk? And there are other optional modules. And in the third year, we have lots of really fascinating subjects. So we have clinical nutrition, the applied nutrition module, which again is a prerequisite for doing dietetics. We do sports nutrition, a behavioural nutrition module. And then in term 2, we do public health nutrition. We have this frailty in Asia, and we have all these other interesting and wonderful optional modules, such as nutrition and cancer treatment. In terms of expertise, as I said right at the beginning, this is one of the key strengths of our course, is it's a very research-intensive university. As you probably have seen, that UCL is always pretty much within the top 10 universities across the whole world. And we pride ourselves on having some really fantastic research, and it is a world leader in a whole load of different disciplines. And so that's very much the case within our course, both at BSc and MSc level. And we have eminent professors teaching our modules. People basically have written the textbooks. I can think of our growth and development module I've just highlighted here as an example. We actually have 4 professors who teach on the module, which is very unusual for an undergraduate module. Actually, if you go to other universities and ask them about how their courses are run, you'll find this is quite unusual. And as I say, these are people literally have created the guidelines. We have one chap who actually developed the growth charts that you may have seen, the World Health Organization growth charts. This is Professor Tim Cole, as an example. And the other thing we're very lucky with, especially going back to this, the whole concept of it being nutrition and medical sciences, and very much closely linked to being a prerequisite to dietetics, is that we have very strong links with UCL Hospital and the Royal Free Hospital. And so we have both dietitians and clinicians teaching on our course, including topics such as clinical nutrition. In terms of assessment strategy, we try to have a very diverse assessment strategy. And the reason for this is, first of all, in terms of it's important that the way we assess you is, first of all, it's fair. Secondly, we're trying to develop new skills, okay, and develop lots of different skills that are transferable and applicable to potentially our future job, future career. So, for example, we do lots of different types of presentations. We get you doing individual presentations, group presentations, video projects, for example, okay? So lots of presentations means it gets you ready, for example, it could be even when you go for a job interview or for a new job, it means you become very good at presenting different things to different audiences. So, for example, some of the presentations we give are more geared towards academic, scientific presentations, for say, for example, to an academic community. And then we have other types of presentations more geared to a layperson. So, for example, the video project for the public health nutrition module is meant to be geared towards, for example, what you might have in a GP clinic. So a video highlighting, say, a key issue, whatever that might be. It could be, we talked today about obesity, for example, or it could be a chronic disease and how that affects nutrition. Then we do other things. We do practical reports, we do standard essays, open book exams, short answer question exams, multiple choice question exams, business case studies, a whole host of different assessment strategies to make you grow as a person. The other thing as well, we're very proud of this, is we have a fully accredited program with the Association for Nutrition, and that's the independent regulator for nutritionists in the United Kingdom. As I say, we are very proud of this. We've had this for a few years now. And what that means is, it means as soon as you graduate, you can then apply to become an associate registered nutritionist. And then after a few years postgraduate study, you can become a full registered nutritionist like myself. And we have a couple of other people in the program who are full registered nutritionists. In terms of career, so we've had people go off and do lots of different things. We've had students go off to do MSCs. So typically a lot of students go off to do dietetics, such as Anissa, who you'll hear from in a minute, public health as well, and public health epidemiology. Okay, so for example, we've had students go off, I can think of one student now who did an MSc at Imperial and has come back to do a PhD here in public health epidemiology. Sports and exercise. Again, I can think of one of our previous graduates who went off to do an MSc in sports and exercise, and then went off to do dietetics at UCL actually. And then we have people go, for example, who might go into work in the NHS, or giving dietary advice. I mean, typically we find that most students go off to do things like dietetics and public health. But I've had students actually go off, for example, doing business studies, economics. I've had two students go to LSE in London doing economics. I think that's the whole thing, is that you learn lots of applicable skills on this course that can be used in other fields, and lots of diverse fields actually. And then just to highlight as well, as Anissa's going to tell you about with dietetics, so we actually have now a number of MSc, we have 4 MSc courses that are really exciting, and we have, I think there's 130 students this year, I think, across all of our 4 MSc. So we have clinical and public health nutrition, eating disorders and clinical nutrition, obesity and clinical nutrition, and dietetics. And I think the thing is just to say is this BSc nutrition medical science degree is definitely sets the scene essentially for all these very clinical focused master's courses. So if you're interested in doing something more clinical, is probably definitely for you. And I'm sorry for going over. I can realise we're nearly at time, so I apologise for that. So before we get into any Q&A, Anissa, would you like to, because otherwise we'll run out of time, would you like to say a little bit about your experience quickly?
Yeah, I can quickly go over like my journey and my experience before we ask some questions. So I did the BSc, I joined in 2018, and like Adrian said, what they taught, like the energy, body composition. So through the nutrition medical sciences course, I got a solid foundation on like nutritional sciences and public health and nutrition and diseases. And I also heard about dietetics through this course, and I felt that through the course I was able to get a good background knowledge on nutrition and sciences, and then that spurred me on to then think more on the clinical side of nutrition, because as much as I do enjoy research, I think I'm more of I enjoy working with people more, so I was more interested in the clinical side, which is then why dietetics was like the perfect avenue for me, because it combined both of my interest in nutrition and interest in working with people and helping people together. And that's why the MSc dietetics course, I'm really enjoying it right now. I'm on my 2nd year currently, so this is the final year of the course. And I think it was good for me to do this, so of course do the BSc, and then I took a year out after that, and I worked in an eating disorder clinic, which gave me the necessary experience needed to work with a dietitian. I worked with a dietitian there, and then I was able to view how the work she does and how she helps people and how she is applying her knowledge on nutrition to different sorts of conditions and diseases, which is essentially the main thing as I would do as a dietitian. So I think I would really recommend this course, like the BSc Nutrition Medical Sciences course in particular, just mostly because of the teaching that you receive and how the teachings that you get from because you get guest lecturers coming in and they're like experts in their field. So you get a real overview on different avenues that you can go into. So I personally went into dietetics, but there's different expertise that come in, and then it gives you more options, it gives you different experiences and things that you can see that maybe could be available to you.
Anissa, that first of all, that's amazing, and it's really nice to hear. It's nice to hear these stories. That's the first thing. I'm really pleased. But you're completely right, and that's what we tried to do, and we tried to have guest lecturers come in to talk about their experience, and so people like yourself can say, "Oh, that's really really amazing. I'd like to do that on a daily basis." Whether it's like you say, work with patients and help people. I don't know if you remember in sports nutrition, but so in the sports nutrition module, and I've tried to expand it this year. We have sports nutritionists and dietitians working on the module, and they're not just delivering content, but actually telling students what it's like to be a nutritionist or a sports dietitian, working with, top sports teams, what's it like on a daily basis to try and help people and enhance their performance, and, you know, that all the different barriers and all the rest of it, you know, and to try to get some insight of what it's like to do that type of job, you know.
Yeah. I think that was what the main thing that took from this course and what I always recommend to people.
It's great, Nisa. Thank you so much.
We do have some questions. Sorry for going a bit over. I will try and just any questions that are similar.
It's okay.
So someone asked, how important is working experience and volunteering to get into the course?
So for this course, for the BSc Nutrition Medical Sciences, that's not such an issue. That the main issue is academically that you meet those key requirements and the science requirements and do well. Okay, any experience is just a bonus. For getting into dietetics, so the 3 years afterwards, that's absolutely crucial, wouldn't you say, Anissa? I mean, that's critical to have some form of work experience. But for the BSc, that's not such an issue. The most important thing is that academically, you're doing well. And most importantly for me, you have a genuine passion and interest in nutrition. So when you come, you know, whatever is it next year or the year after, you know, you really want to be here. You want to, so for example, the stuff that I've talked to you about today, if you found it really fascinating and interesting, and it means that you go off to watch a YouTube video or read a textbook or whatever on that topic, then that's great for me. I think that's fantastic. And because I want to know that this is something that you really want to do. So you want to go off and make a difference, you know? So that's what's important to me, not necessarily having work experience.
Someone else has asked, does UCL offer scholarships to international students? If so, what type of factors are taken into account when offering scholarships?
So I can't personally advise on that, but I know the admissions team do. And I think we can put some, should be some links somewhere we can put in the chat later, can't we? Or we can ask admissions to specifically email you all with some links.
Yeah. I think one more. How many points this is in terms of IB, how many points do you need to pursue the nutrition degree in the IB?
So again, that is in terms of like those requirements, the admissions team can help you with that.
Um, Alicia has asked, if you wanted to do research, what would you do after the degree?
So I'd say this is the perfect degree if you want to go and do research, because again, you know, I can't emphasize this enough. We literally have experts in the field who come and talk about the current research. It's a research-driven course. So you have experts come in and telling you what the current research trends are and giving you experience. I can think of so many examples where either myself or a colleague has given valuable experience to a student to come onto a project for their dissertation, and then they've gone on to then go and do other things, whether it be, for example, a master's degree or further research such as a PhD. Typically, what happens is the process is you go from BSc to MSc to then maybe do a PhD. And I've got some of my current and previous MSc students are now going off and to do PhDs. So typically that's what you would do. But by doing this type of degree, because it's research driven and research focused, it piques that interest. So if you have that interest in research, I mean, you can't go wrong.
Similar question. What careers or slash jobs can you go into if you do the MSc on public health?
So what we have, we have an MSc in clinical and public health nutrition. Okay, this is different. This is you want to go to a different open day. Okay. But I can give you a very brief overview. So, for example, this year, I think we have around 70 students from all over the world. It's very international. We have students, some of them are already dietitians and coming on to get some extra experience. We have people from all sorts of backgrounds, food science, psychology. Some people go on to do eating disorders from psychology, for example. But we've had people go on to do all sorts of different things, working for companies, you know, independent nutrition work, clinically, or they go off to do dietetics. Some of them are actually medics and come to do the course, again, for their own interest, and then to further their expertise when they go back to their country. But yeah, it's a very open field. In terms of the BSc, we've had people do, as I said here, all sorts of things. including as well, I can think of other examples. I mentioned, for example, going to business and economics as well. We have 2 students so far that I'm aware have done that. And one of them's gone to work for a specific healthcare company because of their background on this course. We have someone go on to work for a drug company. So with all this information, you can go into work, for example, for, with extra teaching and learning expertise, you can go on to work for a drug company in lots of different fields. And the clinical nutrition companies, for example, as well, they're always looking for graduates from universities like UCL because they're leading universities essentially. So lots of different things, and I'll be happy to discuss in more depth another time. Anything
Um,
else?
well, unfortunately, we are out of time, and we've actually gone a little bit over. So I think I will have to stop the questions there.
Yep.
But if you could provide us with feedback about today's session by filling out the survey, which I think will be sent to you later on, that would be greatly appreciated because it will tell us what you guys enjoyed and what improvements we may need for the next session. Thank you all for the questions and for your answers, and thank you to Dr. Adrian Slee for such an excellent session. And I hope you guys all enjoyed and have a great evening.
Thanks very much, everyone.
Thank you.
Anissa, thank you so much. And thanks very much for coming, everybody. Okay. I wish you all the best and feel free to contact. Okay. Thank you.
Bye. Thank you.
Bye.